hear me say that, you'll know what I'm talking about. You know, in the medical field, we abbreviate everything. Nobody wants to have to uh, write out something very long, and we also don't want to say things very detailed. So ICD-10 PCS is what replaced Volume 3 in ICD-9. These are the procedure codes for inpatient. And don't worry if you're not familiar with ICD-9 or Section 3, you know, we don't use that anymore. And ICD-10 PCS was developed to replace that. It is a fabulous system for coding procedures and much more inpatient. Um, but we're going to talk about one of the sections, the first section, the first character in a PCS code, and that's Med Surg, which is the largest section out of all of them. Now, again, as you go through here, you'll see obstetrics, you'll see new technology, you know, different areas, but Med Surg, again, is the largest section. The value or the character for Med Surg in PCS is an O, or the letter O, not a 0. So what I want you to do when you think about writing these out, because an O and a 0 look so similar, you know, to strike through the numeral 0, and that way you can tell the difference. That is, you know, you don't usually have to write these out today because we have them all online, but even when you look at those two characters printed out, the letter O and a 0 are very, very similar. Again, this is inpatient setting. Eventually, my humble prediction is that PCS will take over CPT at some point. It's not going to happen anytime soon because there'd be a fight on everybody's hands. You know how long it took us to go to from 9 to 10 in ICD. Let's talk about the different characters when we set up a PCS code. Now, the first thing again would be the character of O, and that is always Med Surg, no matter what, the largest section in PCS. The second character that we're going to be dealing with is what body system we're working in. So are we working in the respiratory system, the integumentary system? Every body system that there is would be signified by the second characters. And all of these characters could be numbers or letters, right? So, and this is a multi-axial code set. So if we're talking about the respiratory system, and let's say, just off the top of my head, which is not true, let's say the respiratory system in Med Surg is a 2, it may not be a 2 in another body system. Okay, so everything's unique and dynamic in and of itself. There are 31 body systems in Med Surg itself. Now you think, wait a minute, no, there's not 31 systems. Well, everything's broken down into a higher specificity. Don't worry if something happens in a future date and you're listening to this recording and there's 32 instead of 31. Don't freak out. Right now, there's 31, and we really can't create new body systems per se, you know, unless they get to a higher specificity. The root operation is the third character that we're going to be dealing with. With the root operation, this is, in my, again, humble opinion, the most difficult area in Med Surg or PCS to determine. So it's really easy to know which section you're in. If you're in like obstetrics from Med Surg, that's just like ICD-10, right? When you're in when you're doing something with an O code for ICD-10 CM, you know, it trumps everything. You know the guidelines that go around, and you're dealing with a pregnant mother, right? And then you could have other things happening, right? But if it starts with an O, that's going to be on the mother's chart, et cetera, et cetera. We know all those guidelines. With the root operations, you have 31 different root operations. Now, don't confuse 31 body systems with 31 root operations. Again, we can change that in the future, and there could be less or more, probably more root operations. But the root operation defines the procedure that's being done to the body system in what category. So if we're in med surge and we're doing the respiratory system, what's the root operation? And we've got more education that you can go look at our YouTube channel about root operations, but root operation is actually the outcome. What's the outcome of the procedure that we want to do to the patient? If we're going to excise something from the larynx, okay, then we know we're in med surge, we're in the respiratory system, and we're doing an excision, right? So that the third character is the root operation. Besides the root operation, everything else is pretty common sense, and even maybe even a layperson could figure it out. But the root operation definitely is going to tap those little gray cells in that medical background of yours, because it does not work like CPT. CPT is all about what we do to the patient. The root operations in PCS is the outcome of what's happening to the patient. Okay, so we'll talk about that a little more in just a moment. Make sure you write in your notebook root operations, because this is going to be the most difficult area for you to learn PCS. But once you've got it, it'll click for you and it'll fall into place, and you'll fall in love like I have with PCS. So make a note, root operations. We'll be talking about it more in depth in other videos. The character 4 is what body part. So let's back up. We're in med surge, right? So med surge. Now, what body system? Let's go back to the respiratory system. And then root operation, we're going to excise something, right? And then what body part? Let's say off the larynx, okay? So what body part? Pretty easy to get to an extremely high specificity. There is not any real nuances to body part. Again, pretty basic as long as you know your terminology and anatomy. Now we're going to move to the 5th character, and that's the approach. So what technique are, and for the most part, there's 3. So we have open, right? We're literally cutting into the body. We're going to open it up and visualize it by opening. Then we have percutaneous, where we're going to stick something into the body, or we have percutaneous endoscopic, where we're going to stick something in the body, but we're going to visualize it through a camera. Okay, so what approach are we taking for the 5th character? For the 6th character, we're going to, if we're going to use a device, and this is any type of a device that's going to remain in the body after the procedure's completed. Best case scenario, it could be a stent that we leave in the heart, or maybe it is a we're putting tubes in a child's ears and the tympanic membrane, or it's a pacemaker. I usually like to refer to a pacemaker because most people realize, yeah, they can visually see that device. 7th character may and may not be used. It is a qualifier. And that is what makes something unique with the procedure that's being done. If we don't have a qualifier, then we just replace that field with a Z. Unlike with ICD-10 CM, your placement holder is an X. With PCS, it's a Z. All right, so make sure that you know that you'll often see the last 2 characters as a Z. If there is no device being used, you'll use a Z. If there's no qualifier, you'll use a Z, okay? Because you want to fill up all 7 places for the code. Now let's move back to the body system and kind of give you an example of what some of those would constitute. Now, again, we have, you think, well, how do we get 31 body systems? Well, for the central nervous system, the CNS, that's an O. right? For the peripheral nervous system, that's a 1. We don't think of them as two separate, right? We think of the nervous system when we think of body system, but they're dividing it up to a higher specificity. That's why we have more. And then for the heart and great vessels, that would be a 2. When you think of heart and great vessels, again, the heart, pretty easy. When you think, well, what's the great vessels? Well, we're talking about the aorta and the superior and inferior vena cava. They're considered great vessels, right? Not just arteries, but also veins. And you don't have to have this memorized. You don't have to memorize that the central nervous system is an O or the PNS is a 1. Because again, it's always right there in front of you. Okay. And if you're in something other than med surg, the CNS might possibly be a different character. It might be a 2 or an A, right? So for the most part, they carry over, but it isn't always. It's always based on the previous character, because PCS is set up kind of like I like to think of it as a drop down. So if you pick this field, then you open it up and it gives you a drop down, a selection of what's possible for the next field or in that field, right? And so once you pick an O for central nervous system, then the next field that opens up gives you a drop down of all the possibilities in the CNS, but not the PNS, because it's not applicable, right? So you just keep fine tuning and narrowing those characters to get to the highest specificity of what you're doing, not only to the body, but the outcome. Root operation. The root operation, again, I told you, was the most difficult to learn. You're not going to get these memorized, but the more you use them, the more you think about it. Now, I'm going to give you a little heads up, because we will talk about this more in depth at another time. When we think of I'm trying to think of one off the top of my head that's a good example. Excision, extraction, right? Those two words sound very, very similar, right? When we think of what you do, you excise something, or you're going to do an excision, or but the definition tends to be very, very different in root operations. And we have done several studies at CCO on root operations and lectures that you can go to our YouTube channel and get more information if you ever have a question about it. But it is also in your PCS manual. I didn't mention that ICD-10 PCS has its own manual. So if you're doing inpatient with ICD-10, you're going to have an ICD-10 CM manual, and then you'll have an ICD-10 PCS manual, which is not set up the same. There is an index, but the tabular looks nothing like your ICD-10 CM tabular, because it's a lot of graphs, or what I like to say is drop downs, but it's really tables. So each one of the 31 root operations have a very specific definition. And then they're divided up into kind of categories, and we'll talk about those. But again, I can't say it enough. This is the area, the root operations, that you will struggle with the most. But once you know where to locate what it is, you'll be fine, right? The definitions, again, are in your manual, and you have space in your manual to write notes and give examples of, like, if we're removing the gallbladder, what are we actually doing, right? Are we removing it? Are we excising it? You know, things like that. Are we detaching it? An example is a detachment. What is a detachment? Well, for a root operation, it's an amputation, but only of the extremities. So we don't detach the ear because it's not an extremity, but we can do a BKA, which would be a below the knee amputation, which would be a detachment of an extremity. See what I mean? Very, very specific. The body part, pretty self-explanatory, but you already know now from what I've said how important for PCS your knowledge of the anatomy and the medical terminology and verbiage is, because it's specific. And if you don't know where or what the saphenous vein is, then you're going to struggle with PCS. Okay, but that's okay, because you can bring up your knowledge by, whenever you see something you don't recognize, you're going to write it down in your notebook and you're going to go look it up and research it, right? So the saphenous vein is in the leg and is often harvested to use for bypass for the heart, just so you know. Uh, we can have, for a body part, uh, there often is going to get to a very high specificity. Thus, again, we need to be able to recognize the terminology and the verbiage that's used. Let's give you an example of that specificity. Tubular body parts. Well, think of a lumen, all right? So that would be the medical term, but they've kind of called it a tubular body part. The definition is stating that it is hollow, it provides a route of passage, okay, and it provides a route of passage for a solid, liquid, or gas, a tubular body part. Examples: the intestines, the esophagus, the arteries, okay, and the veins, things like that. Approaches. Now, I already mentioned a few of them, but there, in some areas, you may only have the open percutaneous and percutaneous endoscopic, and then other areas, you have other options, up to 7, like via natural or artificial opening. So a natural opening would be through the mouth, right? And via natural or artificial opening, endoscopic, meaning we're going to stick a tube down the throat. Then we have via natural or artificial opening with percutaneous endoscopic assistance, meaning we're going to go through the throat, through the mouth, through the throat, but we're going to also visualize with a camera. And then external, meaning we're not cutting into the body itself. Access location, we break that down to a higher specificity. Are we going to use the skin or mucosous membranes? Of course, the inside of the mouth is mucosous membranes. External orifice. Method, are we going to do open? Are we going to use an instrumentation? And then if we use instrumentation, what type of instrumentation will be used? Then we get into our 6th character, which is a device. Now, if we don't have a device, then again, we're not going to use this, and we'll have a Z as the character that holds that place. There is grafts and prosthetics, okay? We have implants. Now, if we have simple or mechanical appliance, you need to know what a mechanical appliance is versus an implant, and electronic appliance. Right now, all of these are defined in your manual. You can look and see what the definition of these are. 7th character is the qualifier. Again, we'll have a Z as the placement. Qualifier is just telling us that we need more meaning behind what is going on with this procedure, okay? So things you need to remember, key points to remember as we walk through this. PCS is going to, in med-surg, is the largest area of med-surg, of the PCS manual. And again, we have a lot of different first characters, but med-surg by far is the largest, so that when we do education, we usually do it with med-surg because we can give the most variety and examples out of that. There are 7 characters with a code at all time. So again, if you don't have a character, it gets a Z, right? The characters are multi-axial, and they will be a letter or a number at all times, a letter or a number. And if you want to locate the code, you can go to the index and use it. Okay. Sometimes you can just, the tabular isn't like the tabular with CM, in that there are tables. So if you know you're in med surg and you know which body system you're in, you can almost flip pages and get to the highest specificity with that instead of having to look in the index. But again, the index has a purpose. Additional things that you need to keep in mind: root operations is what it really is all about. Once you understand how root operations work, PCS is a piece of cake. Then remember that it is the objective or the outcome, the root operation. It's not what we're doing to the patient, it's the outcome. Thus, a detachment is an amputation, but it has a higher specificity because it only applies to an extremity. Root operations also are based on the procedure actually performed, and that's not the way it works in CPT. So we get to a very high specificity and with PCS. That's why it's such a fabulous code set. There is no guesswork in PCS. It either is or it isn't. Now, finally, the approach is also very, very important, but pretty easy, right? We've already talked about that. Devices, they have to remain in the body, thus tubes in the ears. If we're putting a stent in the heart, a pacemaker, it is going to stay in the body. If we're going to put rods or pins in the hip because of a fractured hip. And then seventh character will always be unique and could be a Z, just like if we're not leaving something in the body, the sixth character could be a Z. The guidelines that are applicable here, pretty simple. The guidelines in PCS, I think, are some of the easiest that you can use. So let's talk about them. When we use a guideline, they're going to want to know if there's any conventions. So just like in CM and CPT and even in HCPCS, the conventions are going to be like the characters, like a map. If it's a circle with a strike through, then it's like a knot, things like that. So don't worry about those. Body system, general guidelines, just like with everything else. What is a certain body system and what isn't a certain body system? So those are pretty much the same in all of the code sets. Root operations, little different though. Look at all of our choices. We will have general guidelines, just like we're used to seeing in CPT, but there's guidelines that pertain to doing multiple procedures. We don't use modifiers in PCS because we can get to a higher specificity. Maybe if a procedure is discontinued or incomplete, then there is guidelines that tell us what to do. Also, if we go in and we do a biopsy procedure, that's different. Okay, so it's not like, especially when we're used to using a modifier with CPT, there are no modifiers in PCS, but the definition is always the outcome, right? So the root operation explains all of that. Also, we have possibly a biopsy followed by a more definitive treatment. Okay, so if we go in and we do a biopsy and they say, oh yeah, just by all appearances, this looks malignant, we're going to remove this organ, right? Overlapping body layers. If we're doing a procedure and it is going to encompass more of an area, so we have multiple sites, you'll see that used. Bypass procedures, control versus more definitive root operation. So if we're going to control bleeding, or we're going to actually do something else that's more definitive. Excision versus resection, specific guidelines that define those, because in the root operations, remember, it's the outcome. And an excision and a resection in CPT are pretty much synonymous, but not with PCS. They each have a specific definition. Excision for a graft, so we're going to take tissue from the hip to graft tissue onto the face. Fusion procedures of the spine, again, we have specific guidelines. And inspection procedures, we're going to go in and inspect something. Don't worry, These are defined very specifically so you can't confuse them once you read the definition. Continuing on, occlusion versus restriction. Now, in CPT, pretty much synonymous, right? But not with PCS. Restriction for vessel immobilization procedures versus an occlusion. An occlusion with PCS, much different than a restriction. Release procedure. So we're going to go in and we're going to release an adhesion, for example. Release versus division, two separate things, two definitions. And now I'm not going to get into a lot of details reading and defining these for you because the definitions are in your manual, and we've done a lot of training on this that you can go out and research, but it's in your manual. Reposition for fracture treatment. Now, what do we usually call that? Manipulation, right? But we don't use that term. Transplantation versus administration. So if we're going to transplant something, that is not the same as if we do an administration where we're going to put something into the body. Although we think transplant, right? No, the definition's very, very unique. See the difference, and take your notebook and write on your notebook transplantation and administration, and write down underneath them what makes those different. Okay, so that pops in your head. Transfer procedure using multiple tissue layers. Next, we're going to talk about a higher definition with body parts. We have general guidelines, just like all the other code sets, but then we can get to a higher specificity because branches of a body part, right? Think of a tree, branches out. Bilateral body part values. We have the lung, but we have two lungs, right? Coronary arteries, just dealing with coronary arteries, no other arteries. Tendons, ligaments, bursa, fascia near a joint. So again, we have tendons and ligaments, but things can happen to the tendons and ligaments, but this is near the joint. Skin and subcutaneous tissue and fascia overlying a joint, right? Fingers and toes, they get their own little category, fingers and toes, and they're specified. Upper and lower intestinal tract, divided up. So we're going to work on the upper intestinal tract versus the lower. Do you know the difference? You need to know the difference. Approach. Now, I already kind of highlighted this. We can use open approach with percutaneous endoscopic assistance. We can use external approach, and we can do percutaneous procedure via a device. Now, this is above and beyond what we already talked about with approaches, right? These are guidelines that if we're doing something that doesn't fall into the very blatant or black and white that we mentioned before. Device, general guidelines that define what a device is, and we can also use drainage device. Now, don't overthink it. A drainage device could be a catheter, a general urinary catheter. That's a drainage device. But another drainage device is having a shunt put in the head. Excuse me, hold on. Drainage for fluid, right? I might sneeze. You notice I'm so good. I tried to cover that up so you didn't get that. Okay. Now we're ready to do a little practice. All right. So what are we going to do? Open repair of abdominal wall. Pretty straightforward. So what are we doing? The main term. We're doing a repair. What's the modifying term? Well, we're doing it to the abdominal wall. And so the code that will end up breaking down, and this is not like CPT. You don't just go to the tabular and it tells you. You got a lot more work to do than what we're saying here. So this is, if you look in the index, you're going to look up repair. What are we repairing? The abdominal wall. And then it gives you a breakdown of where you're probably going to be, OWQF 0ZZ. However, when you go to look, you're going to go to OWQ, which Q gives you the root operation because we're doing a repair. And then F, it was the abdominal wall. But because we don't have any more information, OZZ is what's given. But if you're actually putting in a device like a mesh, then it's not going to be OZZ, is it? So again, when you look in the index, it'll definitely get you the first 3 characters and probably into the 4th character. But then you're gonna go to the tables, and just like you would for the tabular, except there will be tables, and then you'll be able to just scan down, run your finger, say, oh, nope, this is what's applicable. Oh, nope, we left in a MASH for repair of the abdominal wall. And then you'll be able to assign the character that is there. This is so exciting. I can't tell you how much I really enjoy ICD-10 PCS, because it really turns the code sets on its head, what we've had before, the higher specificity, the expansion ability. There's no endpoint for PCS because it's multi-axial, whereas CPT, we have to get rid of codes and add new codes, and then we have to put them in out of order and stuff like that. That's never going to happen with PCS. It is expandable beyond our imagination. And thus, I see it eventually taking over CPT. I don't think it'll be anytime soon, but because the AMA has CPT, and that would be a force to reckon with. But for inpatient, that's what you're going to be using. All procedures will be done. Anything that can have an outcome will be done in PCS. But don't narrow your focus and think it is just about a surgical procedure, because it also has new technology, and it also has monitoring and measuring, and as well as counseling and things like that we can do. All right. This has been great. We got a lot more exciting stuff to talk about in PCS alone. And if you have any questions, don't forget, you can go to the cco.us/club, ask your questions. Maybe you are already intrigued and falling in love with PCS. Go into the club and tell us what you like about it, or maybe what is your trepidation about it. What do you think is the learning curve for you? And then maybe we can all discuss it and see how to alleviate any possible fears that you have about PCS. You're going to fall in love with it, though. All right. Happy learning, guys. Bye.